A clinician presses a transducer to a patient's abdomen, and an anatomically impossible structure appears on the monitor. The ultrasound machine is not a camera. It is a rigid calculator, synthesizing images based on a strict set of acoustic assumptions. This diagram shows exactly how the machine plots a pixel. To map an echo, the software assumes sound waves travel in perfectly straight lines. Second, the system assumes the acoustic velocity is perfectly constant throughout all traversed tissue. It relies on the steady timing of the returning pulse to calculate exact depth. Third, it expects the beam to lose energy, to attenuate, at a completely uniform rate as it travels deeper. To maintain an even image, the machine automatically compensates, artificially boosting the brightness of the deepest pixels. Finally, the system expects the acoustic wave to reflect exactly once off any given tissue interface before returning cleanly to the probe. Human anatomy is rarely uniform. Specific tissues and substances routinely break these four rules. When anatomy violates these acoustic parameters, the machine does not output an error message. It simply applies its algorithm and confidently plots a false image. These predictable mathematical misinterpretations are sonographic artifacts. Recognizing them is what allows a clinician to distinguish anatomy from acoustic error. Consider fluid-filled structures, like cysts, and how they interact with acoustic energy. This diagram illustrates a sound wave passing through a fluid pocket, a weak attenuator. The wave travels without losing its normal amplitude. Hitting the solid tissue directly behind the fluid, it sends a massive, high-amplitude echo back to the transducer. The machine's programming is rigid, expecting uniform energy loss at this depth. Because the returning echo is unexpectedly loud, the software calculates the tissue is highly reflective. It renders a blindingly bright white column directly beneath the dark fluid space. Clinicians define this specific phenomenon as acoustic enhancement. A novice relying purely on visual cues might mistake that bright area for dense tissue or a solid tumor, but acoustic enhancement proves the overlying structure is purely fluid. The visual glitch is actually a definitive physical confirmation of a cyst. Now look at the opposite extreme, structures that reflect almost all incoming acoustic energy immediately. Hard calcific substances, solid bone, and soft tissue to air interfaces cause total reflection. In this diagram, the acoustic beam strikes a jagged calcification, bouncing back instantly like an impenetrable wall. The area behind receives zero energy. Receiving no echoes, the algorithm plots a total void, rendering a pitch-black vertical column downward from the bright edge. This is acoustic shadowing. The shadow obscures deeper anatomy. However, its presence provides the exact physical evidence a radiologist needs to confidently diagnose gallstones, kidney stones, or solid bone. Shifting from the amplitude of the echo to its timing brings us to the single reflection rule. The machine determines depth by measuring the exact time it takes for an echo to return. It assumes a single straight trip out and back. That math breaks down when two highly reflective surfaces are located very close to each other or close to the transducer face itself. Look at the pulse in this diagram. A sound wave gets trapped, bouncing rapidly back and forth between the transducer and the shallow reflective interface. Each successive bounce sheds a weaker echo, returning to the machine a fraction of a second later. Assuming every echo is a single reflection, the software interprets these delayed arrival times as signals from progressively deeper structures. For every delayed bounce, it plots a horizontal stripe, creating a ladder-like pattern plunging deep into the image. This multipath error is categorized globally as a reverberation artifact. In clinical practice, this presents in two primary ways: a comet-tail originating from metal or dense calcium, and ring-down originating from microscopic gas bubbles. Seeing these uniform stripes, clinicians ignore the false deep structures. Instead, they look for trapped metal, calcium, or gas right at the surface. There is a complex anatomical region where acoustic geometry routinely breaks down: the junction between the liver, the lungs, and the diaphragm. The diaphragm acts as a massive, highly reflective acoustic mirror, and it sits at an angle to the incoming ultrasound beam. This diagram tracks the errant beam. The sound travels from the probe, hits the angled diaphragm, and is deflected sideways deep into the liver tissue. It reflects off a mass inside the liver, travels back to the diaphragm, and finally returns to the probe. This multi-leg journey requires a drastically increased transit time for the sound wave. The machine receives the echo and calculates the extended time of flight, incorrectly assuming the beam traveled in a single, straight line deep into the body. The resulting output is a visual impossibility. The machine plots the liver tissue and its internal structures far beyond the diaphragm, digitally projecting liver tissue upward into the empty chest cavity. This specific anatomical misplacement is the mirror artifact. Understanding the geometry of the diaphragm prevents a clinician from misdiagnosing a phantom liver mass in the chest. Spatial awareness overrides the machine's digital mapping. Ultrasound image generation is entirely reliant on mapping time of flight and echo amplitude against a rigid set of uniform physical assumptions. As we see in this summary matrix, when those assumptions encounter fluid, calcification, gas, or angled mirrors, the mathematical model breaks down. Newer machines attempt to digitally smooth out these anomalies, but aggressive correction can actually erase critical medical data. To a trained radiologist, an artifact is never an error to be ignored. It is a definitive physical signature of the underlying tissue mechanics. Mastery of diagnostic ultrasound requires looking past the rendered image to identify exactly how and why the machine was tricked.